Hello and welcome. Today we are going to look at atrial fibrillation again, but this time we are going to look at some of those sample questions that can be tested on NCLEX exams and other nursing school exams. These questions will have answers and rationale. They will help you widen and broaden your knowledge on the topic. So let's practice together. Question 1. Which of the following best describes atrial fibrillation? A. Regular rapid contractions of the atria. B. Irregular rapid contractions of the atria. C. Regular slow contractions of the atria. D. Irregular slow contractions of the atria. Pick your answer. The correct answer is B. Irregular rapid contractions of the atria. Atrial fibrillation is characterized by irregular rapid electrical discharges in the atria, causing them to quiver or fibrillate rather than contract effectively. Question 2. What is the primary concern with atrial fibrillation? 1. Decreased cardiac output. B. Elevated blood pressure. C. Increased heart rate. And D. Thickening of the heart valves. What's your answer? Well, the correct answer is A. Decreased cardiac output. The primary concern with atrial fibrillation is the loss of coordinated atrial contractions, leading to irregular ventricular filling and decreased cardiac output. Question 3. Which of the following is a common symptom of atrial fibrillation? A. Chest pain. B. Sudden loss of consciousness. C. Palpitations. D. Muscle weakness. What's your answer? Well, the correct answer is C. Palpitations. Palpitations are a common symptom of atrial fibrillation. Patient may feel irregular, rapid heartbeats or a fluttering sensation in the chest. Question 4. Which of the following interventions is a priority for a patient with new onset atrial fibrillation? A. Administering a beta blocker. B. Administering a calcium channel blocker. C. Administering a thrombolytic agent. And D. Administering an antiarrhythmic agent. What's your answer? Well, the correct answer is C. Administering a thrombolytic agent. In a patient with new onset atrial fibrillation, if there are signs of acute ischemia or significant hemodynamic compromise, a thrombolytic agent may be considered to restore blood flow. Question 5. Which term describes the process of restoring a normal heart rhythm in a patient with atrial fibrillation? A. Defibrillation. B. Cardioversion. C. Ablation. D. Pacing. Pick your answer. Well, the correct answer is cardioversion. Cardioversion is the process of restoring a normal heart rhythm by delivering a synchronized electric shock to the heart. It is often used to treat atrial fibrillation. Question 6. Which of the following medications is commonly used to control the heart rate in a patient with atrial fibrillation? A. Warfarin. B. Furosemide. C. Digoxin. D. Aspirin. Pick your answer. Well, the correct answer is C. Digoxin. Digoxin is a medication that can be used to control heart rate in atrial fibrillation. It works by slowing down the electrical impulses in the heart. Question 7. Which is a major complication associated with atrial fibrillation? A. Stroke. B. Pneumonia. C. Deep vein thrombosis. D. Hypertension. Pick your answer. The correct answer is A. Stroke. A major complication associated with atrial fibrillation is the increased risk of blood clots forming in the atria, which can lead to stroke if they travel to the brain. Question 8. Which of the following assessments is crucial when caring for a patient with atrial fibrillation? A. Monitoring for signs of heart failure. B. Assessing for skin rashes. C. Checking for urinary tract infections. D. Evaluating for respiratory distress. Pick your answer. The correct answer is monitoring for signs of heart failure. Monitoring for signs of heart failure is crucial because atrial fibrillation can lead to heart failure if it is not well managed. Signs may include fluid retention, shortness of breath, and fatigue. Question 9. Which of the following activities should a nurse educate a patient with atrial fibrillation to avoid? A. Regular aerobic exercise. B. Moderate caffeine intake. C. Limiting alcohol consumption. And D. Stress reducing techniques. Pick your answer. The correct answer is A. Regular aerobic exercise. Regular aerobic exercise is generally encouraged for patients with atrial fibrillation as it can help improve cardiovascular health. However, high-intensity exercise may need to be modified based on the individual's condition. Question 10. Which is the most appropriate nursing intervention for a patient with atrial fibrillation who is at risk for thromboembolism? A. Administering antiplatelet medications. B. Administering anticoagulant medications. C. Providing supplemental oxygen. And D. Encouraging ambulation. Pick your answer. The correct answer is B. Administering anticoagulant medications. Patients with atrial fibrillation are at increased risk for forming blood clots. Anticoagulant medications like warfarin or direct oral anticoagulants are used to reduce this risk. Thank you for watching this video. I hope those few questions will help you understand atrial fibrillation. We will be posting more videos on our YouTube channel. Kindly subscribe, like, and leave a comment. Thank you and bye.